Give it a second as folks file in. Just gonna wait here. I'm seeing participants come in. Let that keep going for just a few more seconds here. If you can, please enter your name and affiliation into the chat box while we wait for the room to start filling up. Great to see all the names. I don't get to see all the faces because we're in webinar mode, but see a lot of familiar names. Awesome. All right. Well, I am going to be conscious of time because we don't have a lot of it today. So I'm going to go ahead and get us started. Good afternoon, everybody. I'm Brandon Thorne with the W. Clement and Jesse V. Stone Foundation. And on behalf of Stone and the Robert R. McCormick Foundation, I want to thank you all for joining us for today's webinar entitled A New Unified Early Childhood Agency, Making Service Simpler, Better, and Fairer. As I run through some quick remarks, I see a lot of folks are already doing that, but please go ahead and enter your name and affiliation into the chat box. Today's webinar is going to be the first in a series that's going to focus on this new agency. So please know that today's conversation may go fast, but it's not going to be our last. Just want to also note that we are so appreciative of the over 500 people that have registered for today's conversation. In that, we have parents, providers, educators, representatives from the governor's office, and many state and city leaders and others who all have found time in their day to join us as we hear from a key state leader, as well as 3 national and federal leaders to talk about the important shift that Illinois is undertaking. Thank you all again for being here, and thank you to our colleagues, Key and James at Forefront, for providing the ever so important logistical support for today's session. For the sake of time, I'm going to be pasting links for speakers' bios and any slides that are referenced into the chat. The Q&A feature will be on, so please use that to ask any questions that you might have. We most likely won't be able to get to all of the questions that come up today, but we're going to think about how some of those things might be addressed in forthcoming conversations. Again, thank you all for being here. With that, I'm going to pass it off to Stone Foundation Executive Director, Sarah Slaughter.
Good afternoon. Thanks, Brandon. And wow, so great to see so many of you joining us today. So as you all undoubtedly know, in May, the Illinois General Assembly passed legislation creating a new early childhood agency, transferring programs from 3 different agencies to 1, set up to become operational in 2026. Passing this legislation was significant. It was a big and bold step on behalf of our governor and our legislature. At the same time, it was also just the beginning of the even more challenging journey that we embark on now. A journey that will require us to listen and learn to ensure we have a clear understanding of what is the reality for each and every child in Illinois, and then a journey to imagine what can be and what should be. We applaud the Pritzker administration for leading us on this journey, but that vision, that new reality, will be informed and co-designed by each of the more than 500 of you who registered for this webinar, as well as the many others who are not on this Zoom. As we embark on this journey, Illinois is not alone, nor is it the first. And in a few minutes, we will have the privilege of hearing from some of those who have observed and experienced this from a national perspective. But first, each of you joining today has carved out time because you know the challenges of this historically fragmented approach, this early childhood system of systems. And you undoubtedly recognize that this is not just a new agency, but rather the new agency is the promise of a new way, a better way of working to meet the complex needs of children and families. It is the promise of building a cohesive infrastructure of support that weaves together funding streams and programs, providers and educators, regardless of the sector. So before we go to our national speakers, I'm going to ask our very own Ann Whalen to join us now. And as many of you know, Ann is the Early Childhood Transition Director who is spearheading this Herculean task. So greetings, Ann, and thanks for joining us.
Thank you, Sarah. It's a pleasure to be here today, and a huge thank you to the Stone and the McCormick Foundation for making this opportunity possible. It's so amazing to be able to talk about the new agency in such a fantastic community.
Great, great. So as we said, so establishing a new agency is no easy task. Some may remember the work that went into the creation of the Department of Juvenile Justice. That was in 2006. What folks may not know is that Ann's mom, the wonderful Paula Wolf, was really a visionary in that effort. And then the Illinois Department of Human Services was also created in 1997. Both of those were watershed shifts with Herculean efforts, not without risk and not without challenge. So Ann, sort of starting at a high level, can you talk about why the Pritzker administration wanted to take this move and, some of the problems to be solved and opportunities to be gained?
Sure, I'll get us going. So first, just Governor Pritzker has recognized the importance of early childhood education and care. It was important to him even before he was in office as a governor. And then since he's taken the role of governor, he's been a true leader within our state and across the nation in prioritizing early childhood education and care. And as a governor, he has set the goal for Illinois to be the best state in the nation to raise a family, particularly with young children. And during his administration, we've seen important steps forward, including how we invested the federal stimulus dollars to stabilize the early child education ecosystem during the pandemic, Smart Start Illinois, which has invested significant dollars across early childhood, as well as through governor shifts already with the Birth to Five councils and the Illinois Commission on Funding to really look at how do we improve our system. But there's also a recognition that even with this much progress, we can only go so far with a siloed and fractured ecosystem. So as you mentioned, Sarah, currently our programs and services are spread across 3 agencies: the Department of Human Services, the Illinois State Board of Education, and the Department of Children and Family Services. And I know the teams in these agencies are moving mountains in service of children and families, but you can truly only go so far when you're working in different systems with different technology, different data collection, different cultures, different requirements. So you can only go so far. And I know Brandon's going to be putting in our slide deck, but if you go to slide 3, if you want to follow along at home, this is what I fondly refer to as the spaghetti slide, which is just a snapshot of like what our programs look like today. And it is messy and it is complex and it is really hard to penetrate. So we often have the challenges where there's confusion about who to go, who to call to for what. We have duplicative processes for multiple agencies. There are challenges for providers about where they have to bear the burden of lending and braiding the funds at their level, about navigating multiple data systems and requirements. And truly at a state level, we are not as streamlined and as efficient as we could be. And more importantly, while we've made progress in increasing how we equitably distribute our funds, we have a long way to go with that. So this comes at a cost of time, capacity, and resources that can be better spent elsewhere and in more equitably with children and families. So we are thrilled that the General Assembly, and huge kudos to Leader Lightford and Representative Mary Beth Canty for leading the efforts here. But we are thrilled that legislation passed and we are on the cusp of establishing the new Department of Early Childhood, which will make it easier, fairer, and better for parents and providers across the state to access services and supports. And we will have a unified vision for early childhood within the state of Illinois. And just it's a really historic moment that we're able to say that.
Thanks, Ann. And I know you put what you call the spaghetti slide that shows where the different programs are coming from into this new agency. But I think that it's easy when people think of early childhood agency to have a thought bubble above their head where they picture a child care center and infants and toddlers, which absolutely it is. But it also goes beyond that and to some different, ages and settings. So can you just, for folks who haven't had a chance to study that slide, can you talk a little bit about that, about where it else touches?
Sure. And I just before I jump into the programs and services and the names of the programs and services, I do want to just remind all of us, and I know I don't need to remind this group, but just to call out the extensive research and brain science on the importance of these developmental years and how they will pay dividends in elementary school, in high school, in college, and the workforce. So these first few years, whether it's in a childcare setting, in a school setting, in a home daycare setting, or friends and family or neighborhood care, like they matter and they're important. But if you want to go to the slide deck that is in the chat, on slide 5, we go into a little bit more about what programs are moving. And so you reference childcare, and I think most people think about a center setting when they think about that. And a big portion of the funds that support center settings are our childcare assistance program, or CCAP. And many people on this call may not know that CCAP actually extends up through 13. So it provides services for after-school care for many families. And it also provides services up through 19 for children who have documented special needs. So again, doesn't stop just at age 3 or age 5. The programs that are being proposed to move also includes our early childhood block grant, which includes preschool for all expansion, and prevention initiatives, which includes, in many cases, pre-K in a school setting. Additionally, just on the other side of the continuum, some of the programs that are moving include the state's 3 home visiting programs and some doula services. And so when we think about kind of this continuum of care, it really is an opportunity to align and streamline when we think about the handoffs between early intervention and early childhood special education. Right now, they're under separate silos. We have an opportunity to, as we bring things closer together, improve those warm handoffs for families and, more importantly, for their children. We also have an opportunity to think about multilingual supports. Oftentimes, people think of that solely in a school setting, but there's a real moment in time to think about what do those services and supports look like in different settings across the system. So just want to do a huge shout out that this is a real opportunity to reimagine what we can do, given these programs and support. And then finally, I know I talked about this a little bit, but I've worked in a school district, I've worked in multiple school districts, having data and having different data systems and different reporting systems is hard. And having kind of gaps in what you know is also really hard. And so having a data system that can actually inform, that's timely, that's inclusive, could be a real game changer. So as school districts are receiving kids in kindergarten, and as families are going into programs, how do we make this more seamless and easier for them in our kind of goal of making this easier, better, and fairer as an entire system?
Thanks, Anne. And those of us who know Anne knows how much she loves data, so we know that the data will be well considered. Just before we move to our national speakers, I know that you're co-designing this, and they have lots of committees, and we'll talk about that at the very end, the opportunities to engage. But just give us a little bit of a sampling, if you will. So this very comprehensive, ambitious. You talked about schools, aftercare, childcare, health, doulas. So pick 1 or 2 of these, like either streamline for families or better for children or the workforce or how schools are better positioned. Give us just a few examples of, let's say it's 2026 or 2027 and Illinois is now better positioned. What are some of those obstacles that might be overcome or opportunities that might be seized?
Yeah, first, I just want to acknowledge, again, the amazing progress to date, led by Department of Human Services, Illinois State Board of Education, and the Department of Children and Family Services. They have built a wonderful foundation, and they are really thinking differently about services and support through our Smart Start work, through cost modeling and rethinking our current structures. And I think this is an opportunity to build from there. I also just want to remind people of the timeline you mentioned in the beginning, that while the legislation passed this spring out of the General Assembly and will hopefully be signed by the governor and make us a real live new agency this summer, we do not receive the programs until July 1, 2026. So that's when they transition over to the new state agency. So we have these 2 years to build the capacity of the new agency. And as you mentioned, co-design and integrate these programs. So as we become fully operational July 1, 2026, we will be in a different place building off of the progress to date. And so as we're thinking about this, we know that at the state level, we have ideas that we want to build on, but more importantly, we want to start by centering the voice of parents, providers, and school districts, and educators and stakeholders in the conversation. We have a lot of good to build off of. We have a lot of opportunity, and we need to begin listening to and talking to those least well served by the system and start with them. So we'll talk about this again, but we have multiple ways for people to engage in that work, and I want to highlight that. Being that over the past 6 months in this role, I've heard a lot of opportunity and a lot of places we need to dig into over the next 2 years in order to co-design and reimagine together what this looks like 3 or 4 years from now, when the new agency is launched. And so we've already talked about the opportunity to be simpler for parents to access services. And that includes people saying, we need a single stop shop for where I go to figure out what I'm eligible for and apply. So I'm not filling out 3 different applications for programs and services my family or my children are eligible for. So how can we make it easier from a parent perspective? And that may also include not just within the early childhood setting, but other states have figured out how to bring in other supports and services into that one-stop shop opportunity. We've also heard about the opportunity to reduce burden and uncertainty for providers and school districts, with both the resources and the funding support. And so we're going to examine our funding approach and our funding mechanisms. And this is where I say we have a lot we can learn from what Illinois has already done to date with our evidence-based funding model, or EBF, in our K-12 space, as well as the recent work that's happened under the Higher Ed Commission on Equitable Funding. So we have a lot to build on that we can learn from in the early childhood space there. As you mentioned also, we have an amazing workforce right now in early childhood in the state of Illinois, and we know we need to do better to support them. And that includes strengthening the pipeline. So making sure that we have a way for people to enter and progress and continue to become professionals within this sphere, as well as provide support, support the conditions that they are performing in at the local level. And then finally, compensation. We have a long way to go there, but again, big progress is happening now that we have an opportunity to build off of. And then finally, our hope through the funding mechanisms and through the funding approaches and our data systems is that we'll have a better understanding and a more coordinated response to our service deserts. Through Smart Start Illinois, Governor Pritzker has made a commitment to begin to close those deserts and really look at where we are distributing our resources now, so that if you're a family in a rural community in Illinois, you have access and opportunity to high quality services and supports in a setting of your choosing. And we know that de-siloing this work, creating a single vision for early childhood will help us advance that goal and get us closer to that place of really being able for a family to have access to a high quality setting at any point in their continuum in that early childhood space. And then just to kind of end here, that stronger early childhood system will make a more integrated and streamlined, will create a more healthy partnership with K-12 and higher education. So I think we have an opportunity here, as we're looking to what that North Star looks like, to also make sure that, again, we're not repeating just, we stop here, you start there, but we're actually overlapping, and that there are those warm handoffs, and it's a real true continuum of services and supports. So we are looking forward to the opportunity to work with everybody on this call to begin to map out and design what that can and should look like.
Terrific. Thanks so much, Anne. And I'm going to now hand it over to Brian Stokes from the McCormick Foundation and our national partners. So thank you, Anne.
All right, thanks so much, Sarah. Thank you so much, Anne. Excited, Illinois is not alone in our journey to build this stronger, better system. And so very excited to be joined by Swati Adarkar, Deputy Assistant Secretary for Policy and Early Learning at the Office of Elementary and Secondary Education at the U.S. Department of Education. Jenna Bannon, Associate Director of the Children and Families Program at the National Council of State Legislatures, and Katie Ham, Deputy Assistant Secretary for Early Childhood Development at the Administration for Children and Families at the Department of Health and Human Services. Thank you so much for joining us, Swati, Jenna, and Katie. And I'll start with Swati and Katie from your perspective. Great, I didn't see, I gotta make sure you're all on my screen here. So the two of you, while sitting in different federal agencies, see value in collaborating towards a common goal. Between the two of you and your agencies, you reflect the federal leadership in the early childhood sector, and you have a lot on your plate. So could you tell us a bit about why you take the time to collaborate and communicate? And from a federal perspective, how does this collaboration at a federal, state, and local level, such as the unified early childhood system that Illinois is building, help us reach our North Star of building a great place for parents to raise young children?
You want me to start, Swati? We're even color coordinated. That's how in sync we are across Ed and HHS. It's great to be with you all today. Thank you for having us. I want to just extend my congratulations. I know that when these things get across the finish line, it's often years and years of really hard work. So just a huge congratulations to everyone who's worked hard to get Illinois to this point in time. And it's especially great to see that parents and providers and other stakeholders are already engaged in shaping this, because I think that is so important as well. I think for me, it really comes down to the parent and provider experience. Parents do not care which building in Washington, D.C. issues their grant that their state or their community organization uses to serve them. They want to know where they get services for their 3-year-old who maybe is in preschool, their first grader who might need special education services. Where do they go to get support for their new pregnancy, to get prenatal care? So it's important. It's our job at all levels of government to make it easier for families. And that can look a lot of different ways. It can look like co-locating programs within one agency. It can look like coordination across agencies at the federal or state level, but it's not up to parents, or it shouldn't be up to parents to run around and figure things out. It certainly shouldn't be up to children. I unfortunately visit too many programs where children are moving around throughout the day if they're served by different programs. It's up to the adults in government at all levels to figure it out, so that we're not placing it on families, or even worse, on children, because we're not well coordinated.
I want to echo Katie's congratulations to Illinois for having this bold vision of how to create a more seamless system. And thanks to Brian and Sarah for inviting us to be part of this. There's no question that what Katie said needs to be emphasized and underscored, in that there are no perfect governance boxes. Whatever we do, we've really got to think about how to center the experience of a child and their family and community as we think about creating that seamless continuum and high quality set of experiences across the birth through 3rd grade spectrum, or birth to 8. And so that brings Katie and I together immediately, because we partner very closely, particularly around the birth to 5 years. But as we think about that transition to kindergarten and the K-3 years, there's a lot more of that that's in the Department of Education space. But nevertheless, it will not work well if we don't create a sturdy bridge between the early years and early grades. And so I've been in this position just a little over 2 years, and I feel like, really, quite frankly, from the outset, my interest was, how can I work more closely with how can we at the department work more closely with Katie and her team to really concretize what it looks like to have a system at the federal level that goes from birth through age 8.
Great, thank you both. And following from that theme, Swati, about building that system from birth to age 8, what do you see as being some of the federal resources or guidance that could be tapped to help Illinois as it transitions to this new unified agency and a simpler, better system? And how might a unified system in Illinois best support the transitions and development of children across that continuum?
Thanks for that, those questions, Brian. One of the things going to the data that I just want to remind folks, as somebody who's been an early childhood advocate for a long time and worked a lot in the birth to 5 years, is that, we are appropriately attending to the data showing achievement gaps at kindergarten entry. And we spend not very much time looking at that widening gap during the kindergarten year that persists into and through the elementary grades, making those later school success outcomes of NAEP and third grade out of reach for a whole lot of children. And so I just want to underscore that some of these resources are really important to think about in the transition to kindergarten and the early grades to work in concert with those resources that might not be coming out of the Department of Education, but coming out of HHS. And so we have some resources we've developed at the Department of Education, but we also have some joint resources that we've developed with HHS, and we think that both are important to pay attention to. And so I'll mention a few resources that have leaned into the early grades specifically. We have issued new Title I guidance, non-regulatory guidance on preschool that specific guidance from the Department of Education on preschool has not been issued since 2012. So it was the first time in a long time to encourage school districts on how to use Title I funding for preschool and to layer in braid funding to support children with delays and disabilities using Part B funding and Part C, as well as to support English learners through Title III that can start supporting children as young as 3. Particularly excited about 2 new centers that are technical assistance arm of the Office of Elementary and Secondary Education. Through the comprehensive centers, we'll be launching a Center for Early School Success, as well as a Center for Multilingual Learners and English learners that will really lean into this early elementary, early grade space to bring a lens of child development and the science of learning. And there are some resources that can be probably added in the chat there through the slides we have that provide a more extensive list of this, but we've also done some joint work together with HHS around mixed delivery preschool, as well as policies to support inclusive practices in early childhood programs.
Great, thank you so much, Swati. Katie, turning to you, I've heard you speak previously about the challenges of our early childhood workforce nationally, and talked about the importance of addressing the workforce in her remarks. That could certainly be an hour, probably a 2-hour-long conversation. But could you tell us a little bit about, why do you think the workforce is critical to achieving a simpler, fairer, better system? And how might our new unified approach in Illinois begin to address some of these issues, which have plagued many states?
Yeah, thanks for the question. I really think the workforce challenges is probably the biggest obstacle to early care and education right now. We know that the pandemic created quite a shock to the early childhood system. We saw not only, I think, more and more people realize the critical importance of early childhood educators, but it also created widespread financial disruption that we are still, frankly, in the thick of. So we know in Head Start, for example, we have closed classrooms in Head Start, even in communities where there are waiting lists, because we cannot find qualified teachers who will accept the wages that Head Start pays that are well below what other employers will pay. And it's not just school systems that where people are able to find higher wages. It's food service, it's retail, it's other industries that are paying higher wages. So I think to tackle this issue, it has to be a conversation that centers on compensation, including wages and benefits. I think the pipeline is important, post-secondary education, training, all of these things are important. But if you can't do training and professional development and build a pipeline and do apprenticeships and all the things that we know can help people get into the sector and not guarantee that there's going to be a livable wage at the other end of it, that's a problem, and it undermines your efforts in all the other things that you're trying to do. We've seen a disturbing trend where institutions of higher education are actually backing away from early childhood education because they can't graduate individuals that are then going to be able to earn a basic wage. And at the same time, we know that the most important indicator of quality in an early childhood setting is that interaction between the adult and the child in the classroom. We know how powerful and impactful early childhood education can be, not only for the child, but for the family's economic well-being, the child's long-term growth and development. If we want to reap the benefits of early childhood education and see those benefits in the future, we have to invest in the workforce. And I do think that we have seen that it often takes layering different funding sources, thinking creatively across federal, state, even local resources to get to those higher wages. So I think when you have everything in one agency, it opens doors to think about how are you going to structure a wage scale with different funding streams that can get you to that fair wage and create that career trajectory. I think we've seen New Mexico has been able to do that rather successfully and demonstrate a lot of progress with a similar model. And I think in taking the step, Illinois is very much at the forefront of governance in early childhood education. And I hope it can be kind of a two-way street where we kind of learn from each other, because we're certainly interested in your lessons learned as federal partners as you kind of endeavor to do what only a handful of states have accomplished thus far.
Thank you so much, Katie. And I'm seeing lots of agreement in the chat, and I think everything you said resonates with all of us here in Illinois. Jenna, if I could turn to you, I know that at NCSL, you're seeing lots of states who are in this journey. You, of course, were in Colorado when that state moved to unified agency. Could you talk a little bit about, at a high level, what are you seeing as the goals that other states have worked towards, as they've tried to implement this change? And, for some, what are some of the benefits that they're already seeing or achieving, especially thinking about an inclusive system that spans schools, childcare providers, children educators, et cetera?
You bet. Thank you, Brian. Thank you, Brian and Sarah, for inviting me. I am Jenna Bannon. I'm an associate director with the Children and Families Program at the National Conference of State Legislatures. We are based out of Colorado, but I do want to say that my mom was born in Peoria, my dad was born in Pekin, and I have a huge family in Illinois. So I'm really honored to be here to have this conversation with you. We are getting so many questions from state legislators on early childhood governance. And just to frame NCSL, for those of you who might not be familiar with us, we're an organization that is essentially a membership organization for every state legislator and legislative staff in the country. There are over 7,439 state legislators in the country, and there are over 30,000 legislative staff in the country and in the U.S. territories. We serve them on every policy issue, and I lead our early childhood work at NCSL. So again, as I mentioned, so many calls I'm getting from state legislators about early childhood governance. And so to kind of flip your question a little bit, Brian, I want to talk about why states embark and discuss and even scrutinize their governance system. Why should we be doing this, and should we be making any changes? And so some things in observing all the states that are really kind of talking about this, what they're seeing is that there's a lot of fragmentation. It has been mentioned prior that We're seeing, early childhood, a little bit in public health, a little bit in education, a lot in Department of Human Services, some in economic development systems. And so that can have some unintended consequences when you have it really spread across multiple agencies. Also, we're seeing that having a really meaningful early childhood system allows it to sustain itself over political and administrative changes, right? So having a governor move it one place, move it another place, tuck it here, put it there, creating a department really allows it to have a very, very strong sustainability. Also, we have a lot of states really thinking about how can they make their early childhood system more efficient, right? The duplication of efforts. How do we have a higher impact on the return on investment? Also, accountability. If early childhood is spread across all your agencies, how do you really assure quality? How do you assure accessibility? How do you share outcomes? Also, how do you have it be consistent for families across the state? Also, legislatures are thinking about early childhood governance in terms of attention. For example, if you have a more consolidated early childhood system, and if you have an actual agency, then you have someone who can be joining a cabinet, who can be at a secretary level. For example, New Mexico was just mentioned. So they have a secretary. So they're in the governor's cabinet. They're having those conversations all the time. So it really elevates the conversation of early childhood among all of your systems of government. So what we're seeing as we're looking around at early childhood governance approaches across the country, we're seeing a few things. So the majority of states are doing what we call collaborating and coordinating, right? So you've got multiple agencies working together. For example, prior to coming to NCSL, I was in Colorado. My work, I worked in early childhood in the Department of Education, and I collaborated with the Department of Human Services. And so we had a little bit of block grant money and we did some coordination. So we have 29 states are kind of working in that collaboration and coordination space. And then we have 12 states who have created an early childhood division, right? They've tucked it into a state agency and they're doing that work. So they've kind of brought some things in and created a division. But what you all are joining is a new governance approach. We currently have 9 states. I'm not including Illinois yet because you haven't had your legislation signed, so knock on wood. Right, so almost there. Let's just round up to 10, but we are really now seeing states shift to having multiple agencies come together and consolidate their work, create a new state agency where you have a governor's level, cabinet level position. And this is a really new way of thinking about how to serve families. So I'm going to stop there and just kind of, so my job here is to kind of provide you with the bird's eye view of what's happening around the country.
I appreciate that. Thank you. And I know that you shared some slides that Brandon's included in the chat. And so, this is, of course, the first of many conversations. So we appreciate you starting that. Looking at where we are in time, I want to make sure we have time for questions. And so I'm going to jump ahead to, a question for all three of you. Early childhood has been described as being a patchwork of systems and funding streams, and shared the spaghetti slide of how our system currently looks that have different eligibility standards for children and for educators. And so bringing all of this under one umbrella will require changes on lots of levels in data and funding streams and culture. And so would love to hear, drawing on the expertise and the experiences that each of you have had, is there, one insight that you might share for, leaders and for all of us that are working in Illinois on how we navigate this next 2 years of design? And especially thinking about, what can you share from how all of you have managed this challenge of collaboration across agencies where there are disparate funding streams, disconnected programs, disconnected governance structures? And I don't know, maybe
I'm happy to go first. I do think that, I mean, clearly that this is a huge opportunity for your state to be rethinking early childhood, right? And to be thinking, childcare and beyond. We know that families, their experience of early childhood systems is a fragmented system, right? We go one place for our teeth, another place for our eyes, the rest place for our body, right? This is one place for childcare, one place for mental health care. These systems are fragmented. However, the intention of consolidating is to make sure that all these systems that are out in communities, they're connected, right? And so if I go to my pediatrician and I say, where do I find quality childcare in my community, or just where do I find childcare? Then my pediatrician can say, let me talk to you about quality. Let me talk to you about infant toddler care. Then when I go to my childcare provider, I can say, I need someone to help my children, with dental care. They know the pediatric dental care in their community, right? So it's about cohesion and connection. And so I know that, having been part of the work in Colorado prior to being at NCSL, a big learning for us was that we wanted to have the early childhood conversation happening in all agencies, right? Environmental health, that is early childhood. Transportation, that is early childhood. Financing Medicaid, that is early childhood. So you don't want to take the conversation out of the agencies. You want to rethink the conversation in the agencies and then have a place where that work is cohesive, connected, and collaborative.
Thank you so much. Swati or Katie, any thoughts?
I'll jump in. I think that part of what we have to do at every level of this work is build a common language. We're all sort of live in this specific program or age group that we work with. And that's really challenging. It's really challenging for families, and no one is going to have all the expertise. But I think that common language could really begin by building relationships. And we see some folks on the ground really doing this, where the pediatricians and preschool programs and infant toddler programs and schools, and figuring out what those hubs are to build those relationships, because those enduring relationships is what allows sort of the tough work to continue and for things to stick. And I really want to go back to your mention of data in the first part of the conversation, because we need to figure out a way, if we're making progress, and I do think there's some shared outcomes that we all would embrace in terms of healthy development, following the brain science on how children learn and develop, and making sure the services, supports, and engagement of families is really attending to those wherever children are, in whatever setting, and wherever they are in their development. And we really could get our arms around these common outcomes. I think we could all then begin to think about, well, what's the respective lane to contribute to that? And it's easier said than done, but I do think that we forget to step up to that broader perspective sometimes and think more about what we have in common in terms of the objectives in supporting children's healthy development and school success versus the disparate parts.
Yeah, a lot of what Jenna and Swati shared resonates with me. I think I would add really focusing on parents and providers and their experiences, and centering the design on what they need and what they're looking for and where they are. And I think as policymakers, we often have the best of intentions, but if you're not connected with that end user, and not just as one or two parents joining a committee, which is helpful, but all parents are different, all providers are different, they have different experiences, but really, going to rural areas, urban areas, talking to parents who are part of historically marginalized communities, to make sure that you're really getting everybody's experience and building something that is going to work for a diverse group of families that are going to be using the services is critically important. I think too, oftentimes, and I will point the finger at myself here, we have processes and protocols and standard operating procedures in government that we stick to and follow for consistency, but sometimes they don't always make sense. And we have to challenge ourselves to think outside the box. And I think when you're starting something new and you're blending programs from different agencies, that's really important to ask yourself why we've always done something that way and rethink it in a better way and not be tied to the way we've always done things as we reimagine the system. So I will leave it at those 2 points. And I'm really excited to see what comes from this.
Yeah, but Brian, if I could add just one more point quickly.
Sure.
The other thing, in my portfolio, I have early childhood and I have child welfare, and I am struck by the disconnects between those two systems. And when you look at the data, the highest rate of removal are newborns, infants, and toddlers in the child welfare system, and that is because of neglect. That is because of substance use disorder of mothers. And there's I think beginning to think about how to connect into the child welfare system, because there's a lot of early childhood happening there. And whether you have MOUs, like some kind of way to strategically stay connected to all the places where your infants and toddlers are being impacted, that is another place where you don't necessarily move it into the department, but you find a way to really solidify the bridge.
Thank you so much. I think that might be a great future topic for this series, is thinking about child welfare. You're absolutely right, knowing how many of our infants and toddlers are a part of that system. Thank you so much, Katie, Swati, and Jenna. If I can ask you all to stay on and bring back Anne. I know we have a lot of questions that have been entered, and please continue to add those. And I know that Anne and Brandon have been answering some of them by text. Maybe, Anne, if you'd like to start, there's a great question from Lynette. In what ways will the new agency carry through the infant and early childhood mental health consultation cross-system work that's been happening?
Sure, that's a great question. And I know we've been talking a lot about it within Illinois over the past few years, months, longer for some of us, and how we can integrate this better within our systems. And I know, again, I will talk about this later with Sarah, but over the next 2 years, part of our work, and I think you've heard a lot of this conversation today on this call, is that we really need to start with the voices of families and those who are closest to families to identify opportunities and ways we can improve the system. And so our commitment over the next 2 years is to do that. And we are not jumping to conclusions about what something needs to look like or has to look like at this point in time, because we purposely built in these 2 years to make sure that we are starting with the experts, which are those that are closest to families and families themselves. So this is definitely a topic that will be like part of our conversations, and look forward to working with you, Lynette, and your colleagues as we talk through the opportunities here. I would also just shamelessly plug that federal colleagues, please close your ears. We have the preschool development grant opportunity coming up at the end of next month. We've had a lot of people identify when we ask stakeholders for projects and ideas that we should be including these in our application. Like, this was definitely a priority and a theme. That's something we came to the community with, and the community has come to us with. So we see that there's a lot of synergies.
Perfect. Thank you. There's a question here from Vanetta, and maybe Anne and Katie would love to get your perspective about how will federally funded Head Start, early Head Start programs be connected. So maybe what's sort of the Illinois approach, and then would love to hear how it's worked nationally.
Can we flip that order? I would love to hear how it works nationally.
Sure, I'm happy to start. So as I think everyone probably knows, Head Start and Early Head Start are federal to local grant. It's a federal to local grant program. So we have 1,600 grantees around the country that operate 20,000 locations, serving about 650,000 children birth to 5. I think it looks different depending on the state, frankly. We also fund a Head Start state collab office in each state. with the goal of making sure that Head Start is connected with state systems. I frankly think that there's a huge spectrum of how well it works. I think in some areas of the country, Head Start is more isolated from state programs. In other areas of the country, it's more integrated. What I will say is I think it's particularly important when there's a really strong state infrastructure like there is in Illinois, that there's connection and that relationship goes both ways. I think it's important that Head Start is at the table. I think historically there has been trepidation, frankly, around too much state involvement in Head Start because in the past there have been proposals that would more integrate Head Start into state programs. I think there's always a little bit of fear that Head Start will at some point go in the direction of a state program, and there was kind of good reason to make it a federal to local program. But I think that more and more when I go to visit Head Start programs, they're not just getting federal Head Start funding, they're also getting preschool funding from either their state or their local community. They have childcare funding that they're using for families that are make too much for Head Start or before and after care or some combination of the two. They're getting IDEA, special education funding to serve children. So I think this idea that we have kind of standalone Head Start programs seems to be less and less true. And I think now it's more important than ever that Head Start is really working hand in hand with other providers in the community and is connected to state systems. We've always prided ourselves on Head Start being the gold standard in early education. And I think that continues to be true. And Head Start has a lot to offer as a model of comprehensive services. But we also need to be thinking about how Head Start works and functions in a larger state system. When Head Start started in 1965, it was the only game in town, and that's just not true anymore. And I think we need to recognize that reality and push from the federal side and the state side to make sure Head Start is always at the table.
And then in Illinois, at the most basic level, as people probably saw from the slide that was placed in the chat, the Head Start Collaboration Office is part of the portfolio that will transition to the new agency. It currently sits in DHS. As we have begun setting tables, including our Transition Advisory Committee, we have providers who, as Katie mentioned, are both recipients of state dollars, but also are Head Start recipients of Head Start dollars and are leaders within the Head Start community. And would just do a huge shout out to those Transition Advisory Committee members on the call, because you guys bring a wealth of knowledge and expertise as we are making sense of the input we are receiving and setting our priorities for the future. And as we stand up work groups, like we want to make sure that we have representation from across the ecosystem in different roles with different resources and dollars, because we have a lot to learn and leverage. We have a lot of assets across the state, and we want to build off of that. And there's been a lot of work happening to date with this collaboration between Chicago and Head Start providers within Chicago that we can learn from and build off of, as well as some of the strong collaboration that has happened across the state. So I think there's real promise to continue to grow there.
Great. Thank you so much, Katie and Ann. I know we're running low on time. Maybe one additional question here is a few questions about the relationship between LEAs and city agencies that administer early childhood and this new agency, especially Natalie's question about LEAs that receive funds for early childhood special education. How are you thinking about their relationship to the new state agency?
So this, I think, is a question for me. So I will start, but then also anybody on the panel should definitely jump in. One thing I would point out for this group on the call, and I apologize, I'm going to get super wonky here, but the early childhood special education dollars, the vast majority of our dollars are provided by a federal grant that is provided to us by the U.S. Department of Education. And within that grant, so within federal law, federal statute, our state educational agency, or in Illinois' case, the Illinois State Board of Education, has to be the fiscal agent of those funds. So we don't have the the opportunity to change which agency is the fiscal agent of those dollars. And we know that there's a lot of opportunity to increase alignment, increase opportunities for inclusion, improve both the family experience as well as the provider experience within this work. So we have stood up a work group last month that is focused on how do we improve this work as part of the new agency that is standing up. And I will say we are looking to other states. I think we've heard a couple other examples on the call. We also know Michigan is another example who is really trying to think hard about how do we integrate particularly EI to early intervention to early childhood special education services. So we want to be able to look to see how others are having success and figure out what we can adapt for Illinois and build off of here. But welcome if there are other examples from those on the call who would suggest we look to.
All right. Well, I think that might be a topic that's worthy of another conversation, definitely. Thank you so much. I will hand things back over to Sarah.
Well, thanks. And we will end on time. And before we thank our speakers, I just want to give Anne a final opportunity to talk about, how to engage. Some who are on this, some have already engaged. Some will want to be very directly engaged on a committee, and others will just want to follow along. And I will say that McCormick and Stone are committed to, as we said, doing sort of a series of these, and everyone will be receiving invitations. But Anne, tell us about how the different ways folks can stay engaged. And we also know that this is going to require additional investments, and how this group can help make the case to the legislature and to the public about why additional funds are needed to make this a reality.
Thanks, Sarah. So as we are embarking on this transition, we are really trying a couple new things and new ways to engage with families and providers and other stakeholders across the state. Some we will get right, others we will learn from and adapt and readjust. So we have a couple different opportunities. We have at the basic level, our website that people can peruse at their leisure and learn about the transition. There's also a link there in both English and Spanish where you can self-identify as someone who wants to learn more. So you can receive emails. You can say, I'm interested in participating in a work group, or I'm interested in being part of a focus group, or just receiving surveys. So depending on what your time capacity is, you can self-select in what you feel comfortable with. We also hold bi-monthly listening sessions where anybody from the public can come and join and hear updates about the transition, as well as share their questions and their priorities for the work. We also have a transition advisory committee, as I mentioned, that meets monthly. That is, anybody from the public is welcome to join, but these are individuals from across the state that represent different roles within our ecosystem who are keeping the state on track to making sure that we are centering the voice of parents and families and really focusing on equity and racial equity in this process. So again, huge thank you and shout out for those members who are supporting us in that effort. And then finally, this summer, in partnership with many people on this call, thank you all, we are launching regional listening sessions where coalitions, regional partners, ROEs are going to host or co-host, based on what they're interested in, just a conversation to share some updates about the transition and begin to ask stakeholders what their questions and priorities are and provide us that input so we can continue to use that information to inform the transition work. So we're really excited to kind of pilot some of that work and improve upon it, but also welcome any additional ideas people on this call have about how we can create multiple modalities for people to engage in this conversation.
Well, it is the top of the hour. We want to respect everyone's time. It's a tired saying that it takes a village to raise a child, but we had a tremendous sampling of that village that it takes to raise children. And we just want to thank everyone for joining, and particularly our speakers who gave us their time today, and hopefully might give us their time again in the future as we move forward on this journey. So thanks, everyone, and have a great evening.
Thank you.